Molly Corbett is our expert today from Livingston Memorial Visiting Nurse Association and Hospice, a nonprofit organization providing compassionate home health care, skilled nursing, therapy, palliative care, and end-of-life hospice care for Ventura County residents, focusing on quality of life and support for patients and families dealing with serious illnesses and offering free grief services too. They've been serving the community for over 75 years, making house calls since 1947, and are known for their comprehensive, patient-centered approach. Did I get all that right?
You got it right.
Okay.
Spot on.
Hi, Molly. Thanks for coming on the show.
Thanks so much for having me. I'm delighted to be here.
So tell the people about yourself.
Sure. So I've been with Livingston since 2018. And became the Chief Administrative Officer right when COVID happened, same March 2020, and then was recently in 2023 appointed the CEO of Livingston. Very proud to be a part of Livingston. It's really, I say that it is a cornerstone in the community. We're the longest running home health and hospice in Ventura County. We're the only nonprofit home health and hospice in Ventura County. So we take a lot of pride in really serving everyone in the county.
And are you a county resident? Do you live here?
I am. I live in Santa Paula. I love it. So actually, my husband and I had lived in Ventura back in 98 to 2000. Moved back to the East Coast, and then in 2016 we moved back to Ventura County, and was really delighted to be offered a position at Livingston, because I knew Livingston from when we lived here before, and what a tremendous organization it is.
75 years is a very long time
for
an organization to stay around.
Yes.
What's the secret? Do you have a secret?
You know, I think the secret is really holding true to our mission. Our mission is to provide compassionate care to anyone in the county, regardless of their resources, whether those are financial or social resources. We want to be there for everyone. And so healthcare over those now 77 years has changed tremendously. Healthcare in the last 5 years has changed tremendously. And so I think having our mission as our guidepost, and that's our purpose, has helped us to have that longevity.
And you can see all of your accomplishments and everything about the Livingston Memorial at lmvna.org.
Correct.
Okay, so I see on that website you do a lot of really fun events for the community.
We do. We have some great events, and actually one of our signature events is held right here in Camarillo, and over 800 people a year attend. It is the garden tour. So it's one of the last remaining garden tours in the area, actually, and it is completely run by volunteers. We have a volunteer committee that organizes everything, and they also they then recruit other volunteers to be docents at the home. So it's usually 4 to 5 homes, private homes in Camarillo, and you buy a ticket for $30 and you get to go visit all of these amazing gardens, all of them different, so some are small, maybe it's a succulent garden, other ones are very large homes with very large gardens. We've had gardens, homeowners who have had gardens that, represent their travels, or they have built structures and artwork in their garden. So it's really exciting. And all of that money goes directly to supporting our free grief and bereavement programs, which are held here in Camarillo.
Now, is that a unique thing to have for a memorial organization, to have free grief?
Yes. I mean, it's really, Livingston merged with Camarillo Hospice in 2017. Camarillo Hospice had this grief and bereavement program, and so when we merged, we wanted to be able to keep that for the community because it's so important. But it is, we offer here for the grief and bereavement, we offer one-on-one counseling and support groups. And so it's important to have that in the community for everyone. We have children as young as 4 through adults who participate, and we do trainings at local schools. so that the school wellness coordinators can be there to provide grief services for students. So it's a really important asset for the community, and the garden tour supports that. We also have an event called Mother's Day Luncheon, which is held here again in Camarillo at Las Posas Country Club. And we pick 2 mothers each year to honor. So one living, one deceased. And we have their families come and share stories about them. And it's really a wonderful event. One of the things I love about Livingston's events, and I think this goes back to really our mission, is that we're here for the community. And so our events focus around the community. We don't have auctions and paddle raises and all that kind of stuff. We ask you to come and be part of the community, and really, for Mother's Day, really celebrate all mothers, but especially these 2 women that have impacted our community.
Yeah.
And that will be held this year on April 17th. The garden tour will be held on the first Sunday of May. That's when I'm told, I'm not a gardener, but that's when I'm told the gardens are at their peak. Mm-hmm. So I believe it's May 3rd this year. And then we do 4 events within 10 days in December.
Really?
Which is kind of crazy, but they're amazing events. And it's our Light Up a Life event. And we just completed those. We have one in Camarillo, one in Ventura, one in Oxnard, and one in Ojai. And each event is really a reflection of the community that they're held in. And so the one in Camarillo has been going on for, I believe, I don't even want to say, I believe it's 40 years, but it could be more than that. And many people in Camarillo may know it as Tree of Life. And so we call all of our events Light Up a Life. And it's really just a chance to remember a loved one, come together in community, and get to say their name. And you get to say their name out loud, and everyone's there hearing their name, and kind of, I always say community, we always think of community as it's a place where you share your joys and your triumphs. But if it's true community, it's also a place where you share your grief and your sorrows. And that's really what Light Up is. It holds us all together.
We do great work. I came here to the headquarters today, and I noticed a lot of things for the holidays to get you through it. A lot of grief counseling. It really is great what you do for
it's a hard time of year, especially that first year that a loved one's gone. And I'm happy to know that we're here to support anybody who needs it.
You're a bright spot.
Yeah, thank you.
Molly Corbett is our guest on Ask the Expert today. And if you'd like to ask the expert a question, you can. Give us a call, 833-346-4626. Once again, 833-346-4626. Molly, do you have an email or a phone number that people can call you?
Sure. So our phone number is 805-642-0239. And that's our main number. And my email is mcorbett, CORBETT, @lmvna.org.
And that is the website where you can get all the information. You can learn more and make a donation.
Absolutely. We have many programs that run on donated dollars, and it's really critical. There are hundreds of people every year that would go without home health or hospice care without those donated dollars, and not to mention all of the individuals who get the grief counseling. That is all completely donated dollars.
So let's talk about the farmers market, because that is just such a blessing.
I love the farmers market.
How long have you been running things, partnering with them?
Sure. So the farmers market will celebrate its 35th year next year in 2026. And the farmers market was actually started by volunteers from Camarillo Hospice. And so they started the market. It is completely volunteer run. There is no Livingston staff that run the market. It has been volunteer run since the inception. When we merged with Camarillo Hospice in 2017, we are very proud to kind of carry that mantle forward. I will tell one quick funny story about the market. When COVID happened, we were really committed to keeping that market open. most of the volunteers were under, at that time, if you remember, there were stay-at-home orders for individuals of a certain age, and we didn't have any volunteers. And we had staff, family members volunteer. We had National Charities League volunteer. We had so many great volunteers, and we were so proud that the market never closed. The market stayed open the entire time during COVID because of the precautions that we took, but also of the community support to keep it open. So it's an amazing, amazing market. If you haven't been out, I encourage everybody to come out. There are the fruits and vegetables. There's prepared foods. There's crafts. It really has everything. Yeah, live music, and we also have craft programs for kids there. So there's a separate website. It's CamarilloFarmersMarket.org, and you can go on there and see the vendors who are going to be there each week. It's amazing.
Every week it's a little different.
It is. It is. Right?
Saturdays 8 to noon.
That's right. Every Saturday, 8 to noon, except the Saturday after Thanksgiving, I believe.
Yeah.
And then a Saturday in July when we have Fiesta.
Like the one after Christmas?
Yes, right? That's right. That's right. One after.
What about the New Year one? Are you open?
I believe we are open. I think that's the second.
Okay.
Second or the third. Yes, we are open. Yes.
Okay, so before we get to the listener questions here, thank you so much for being on.
Yeah.
I'd love to ask you about something monumental that has happened with Livingston.
Sure.
Or maybe you'd like to spotlight one of the volunteers on your team.
Right. Well, I do want to share, because it's a very, very proud moment for us, is we are a 5-star, Medicare-rated 5-star hospice. We are one of 11 in the state of California, and less than 10% of hospices nationwide have this 5-star rating. So this rating comes from patient or family satisfaction surveys and is reported to Medicare. So this isn't a Google rating or a Yelp rating. This is actual, through Medicare, a rating. So I'm very proud of that. We're the only one in Ventura County.
Sounds like it's really hard to get.
It's very hard to get. And, it shows that how much our staff cares really about the patients and the patients' families. Mm-hmm. Yes.
Great.
Yeah. And I think there's too many awesome volunteers to pick one. I'm sorry.
All of you.
That's right.
Each one of you. And all of you volunteers who haven't started yet.
Correct.
There's still openings.
So I do just want to mention, we have a program that is, again, through a grant. We hired a community engagement manager. And this program was really designed, our previous Surgeon General had declared a epidemic of loneliness in the U.S.
It's a real thing.
It is. Mm-hmm. It's a real thing, and we see it all the time. And so her role is to recruit volunteers just to go visit seniors who are living in board and cares or in facilities that may not have family that visit them, that may not have anyone to come do a craft with them. And yes, some of the facilities have wonderful program directors, but the need is still more. And especially in the board and cares, which are the smaller homes that maybe have 4 or 5 people, and they have limited staff, and the staff are really taking care of the residents. Our volunteers come in and do a life story, which is an interview, and then create a book, or go in and play cards. We have one volunteer that goes in and asks, "What's your favorite dessert from childhood?" and then bakes that and brings it back for them the next week.
Wow, that's extra special.
Yeah, so all skills are welcome, and it's a really unique program that we offer.
That's great.
Yeah.
We're speaking with Molly Corbett today, the top cheese, the CEO of Livingston Memorial Visiting Nurse Association and Hospice, nonprofit organization here in Ventura County. And if you have a question for the expert, you can always call or text 833-346-4626, or you can email Molly direct at mcorbett with 2 T's.
Yes.
At lmvna.org. Once again, lmvna.org. Okay, let's take some listener questions here.
Okay.
So what is the hospice benefit, and what are your rights under Medicare?
I so appreciate this question. And let me just preface a little bit the importance of knowing what this is, especially here in Ventura County. Ventura County has one of the highest saturation of hospices in the country. So California has had a problem with for-profit hospices growing exponentially. And people may have read about it in the Los Angeles Times a couple years ago. LA County is the worst county in the country for it. But because of our proximity to LA County, we now have that as
looped into it, huh?
Absolutely, as an issue here. And if you go to the website Medicare.gov and go to Care Compare on there, and you put in Camarillo, I did this right before I came over, and you put in Camarillo, there are 132 hospices that come up serving just Camarillo.
Wow.
Of those 132, only 7 of them have a star rating with Medicare, 3 stars or more. There's a couple that have a 1 and 2 star. The vast majority do not report their data and so are not compliant with Medicare. And I think that's really important for people to know. One, what is the Medicare benefit and how to ensure that you have an appropriate agency serving you. So I'm going to put my glasses on and read this part because I don't want I have some notes with me and I just want to make sure that I have everything correct. So the Medicare benefit is the hospice benefit is through Medicare. And so it covers it's for terminally ill individuals, and it focuses on your comfort and pain management and your quality of life rather than curative. So it's for individuals who have been given a terminal diagnosis by a physician, and they're waiving their rights or they're waiving any curative treatments. And there comes a point for many individuals where the quality of the life that they have left is more important than going through additional treatments when the medical experts have said these are probably not going to work. So it's a team-based, multidisciplinary approach. So it's really focused on the patient and the family or friends, whoever that patient's support group is. And they receive support from nurses, from a chaplain, from a social worker, from a home health aide, and when necessary, a physical therapist as well. So it's really the whole team supporting them both while the patient is on care and then after the patient passes, making sure that they have the grief support and the bereavement support that they need.
So it's all included.
It is. Mm-hmm. It is. So it also includes your medical supplies and your medication. So when someone goes on hospice, they don't pay for anything. It is all covered by that hospice agency. And that's really important to know. There are qualifications to qualify for hospice. Everyone's not appropriate for hospice. Right. And so it's important that you know that you're with a hospice agency that has a qualified physician who knows how to certify patients for hospice care. Mm-hmm.
Okay, great question. Yeah. Okay, tell us please about hospice fraud and what should we be looking out for? What are the signs of hospice fraud? What do we do if we suspect fraud?
Right. So this is an important question unfortunately for us here in Ventura County because we see it quite often.
There's so many of them, and
there's so many. Yes, there's so many, and it's unfortunate that there are so many for-profit ones that are really looking to make a profit off of this. This is, my mother was on hospice. This is a very emotional and painful time for any family to go through, and so to be taken advantage of at your most vulnerable, to me, is
the worst.
It is. I actually can't imagine how people do it, but unfortunately we all need to be aware.
You can't prepare for this either. It's like something that you're not looking out for fraud. You're just thinking you're going through the process.
Exactly.
But you have to check.
Exactly. So some of the Some of the warning signs of fraud is if you are being approached by a representative from a hospice agency and they're offering you gifts, that is not legal. They cannot offer you gifts to sign up for hospice. So if you are not, if you do not have a terminal diagnosis, you are not appropriate for hospice. If you do have an order from your physician for hospice care and you go on hospice, but you're not receiving any services. So if you haven't heard from or seen anyone in a week, that's a red flag. You need to find out what's going on. If you call the hospice agency in the middle of the night because you need help, and they're unable to send anyone out to provide care for you, we are required to provide care 24/7. That is a red flag. So those are some of the big red flags, especially the offering of gifts to come on to care, or the pressuring, pressuring you to sign documentation that you are unaware of really what it is. Right. Yeah.
Fraud is out there every time. I just got hit with when you see the text messages coming in and they say, reply stop to opt out, you're not opting out. You're proving to them that your phone number is real. Fraud is everywhere.
Oh, I did not know. Thank you. I didn't know.
Just a little tip there.
Yeah.
Okay. All right, here's another question. Besides donating and shopping at the market,
yes,
how can we help? How can the community volunteer, get involved?
Absolutely. So we have so many opportunities to volunteer. We really do. So we have hospice volunteers, and they go and visit our hospice patients. And so, they offer a respite for the family member who's caring for them. They may go, they may just sit with the patient. They may go and play cards, variety of different things, but they offer comfort to the patient and comfort to the family as well. So that's probably what most people know our volunteers as the hospice volunteers. But we also have the community engagement volunteers. And I think that's such a wonderful opportunity for somebody that, they play the piano and they'd like to play the piano for others, or they sing, or they read a book. We have a wonderful volunteer who was an actor, and he goes to a board and care and he reads, and the 5 residents there wait for him every week to come to read to them. He's such a wonderful actor. He acts it out as he's reading it. And then we have the volunteers that we need for all of our events. We need volunteers for the farmers market. So if you like to shop at the farmers market, why not sit at the manager's booth for 2 hours? They're 2-hour shifts. And you can come and support the community that way. We also need volunteers for the garden tour and light up. So all kinds of opportunities. I would really, if you're interested in volunteering, reach out to Violet Way. So her email is vway, W-A-Y, @lmvna.org. And she will connect you to the right person to get you volunteering. Yes.
You guys are tackling loneliness one by one.
Yeah, absolutely. And that's building community.
Yes.
That's what we do, right?
Well, Molly, thank you so much for coming on. This is a delightful conversation.
Yes, thank you.
So for people watching and listening who would like to meet you, maybe ask some more questions, how would one do that?
Sure. So they can call that number, 805-642-0239, and ask for me. You can also send me an email, mcorbett@lmvna.org. Yes. And if somebody wants a speaker to come out, Rotary, Lions, Moose Lodge, whatever it is, their church, their community group, we're happy to come and provide a speaker. We have lots of different topics we can come and speak on.
I love that. Molly Corbett, thank you so much for being our expert today.
Well, thank you for having me.